So I'm Fee, and I'm the Health Literacy Officer here at the Healthcare Consumers Association. And today we're going to be talking about managing your medicines and giving you some tips and tricks for doing that. Before we get started, I'd like to acknowledge that most of us will be on the lands of the Ngunnawal and Ngambri people in the ACT. Though if anyone is from elsewhere, do pop what country you're on in the chat. And I'd like to pay my respects to their elders past and present and acknowledge their continuing contribution to the culture of Canberra and the region. I'd also like to acknowledge that sovereignty was never ceded. So I will just start sharing my screen for you all and we can dig right in. Okay, just find everything. Okay. So today, as I said, we're talking about managing your medicines, and I've got with me the lovely Bryony from Calvary Hospital, one of the pharmacists who'll be helping answer some of our more technical questions.
Hello.
Good morning. Thank you for coming. I'm, of course, not a pharmacist, which is why I like to have an expert here. I'm just a health consumer like you. So a lot of the things that a lot of questions I've had in the past, maybe ones that you've had. So we've collected questions from the start of registrations, and we'll stop for questions at any point during this. So do chime in. Just while you're not talking, please pop yourself on mute. And we are recording this session. So if you would prefer not to be recorded, just turn off your camera and we'll make sure that you're not included. This is so that we can share it with people who couldn't make it. The other thing is that I've got Darcy, one of my colleagues, here to help us out with any tech support needs. So she'll be getting the chat and making sure that I don't miss any questions that come up. So you can pop your questions in the chat or put your hand up so you can ask them yourself. So I'll just get everyone to pop themselves on mute now if you can. Thank you. Alrighty. So this is what we'll be talking about today. We're going to cover what is a medicine, because it might be a bit broader than you think. We're going to talk about generics versus brand names. It's a really common question. Active ingredients and what that actually means. Some questions that you should ask about your medicines. A little bit about costs. And of course, some tools for keeping track of all your medicines so that you can avoid any safety issues or accidentally taking those sorts of things. We'll also give you some links for more information, and we'll send out a little package after this with all the resources you might need. So first thing we're going to talk about is what is a medicine. So fundamentally, it's a substance that's used for treatment or prevention of a disease. So we usually think of prescribed medicines or even over-the-counter, things you get in the pharmacy, but it does also include vitamins, minerals, natural sort of health products, so herbal medicines, traditional medicines, and complementary medicines. And it's important to know that those all count because they can all interact. I did want to stop for a moment to see if that's, unusual, if someone hasn't heard of that before, and if there are any in particular you've got questions about we want to get to today. So does anyone have anything they want to ask before we really dig into it? Cool. So just talking about the different forms of medicines. It's everything from tablets, capsules, liquids, but it also includes things like suppositories. You might use injections, even patches for some medicines. So there's a lot of different forms which can be confusing if we're trying to keep track of them all. So I just use this slide so you know all the different forms. And one of the reasons we give this talk is that because of how confusing medicines can be, and also people just not having enough information about how to manage them, that we have quite a lot of statistics on what we call sort of mishaps with medicines. So it's things like you may accidentally take two because you've been given a different brand name, or you might have been prescribed a medicine to take for a set period of time and you take it a bit longer than you should, and that leads to side effects, things like that. And we know statistically that 20 to 30% of hospital admissions for people over 65 can be related to medicines in some ways. This could even include things like falls because of a side effect that causes you to lose your sort of equilibrium, but also just mistakes and accidentally taking the wrong dose or things interacting. It's about $19 billion spent on medicines each year, and I think it's about 15 billion of those is through the PBS, so the public, the pharmaceutical benefit scheme that you get those discounted rates on. So there's even quite a portion of that, about 4 million, that are non-PBS medications that you might have to claim on your health insurance. So it's a really big industry, and making mistakes with these is quite costly. And just for a bit of perspective, these stats are from 2014, but about 53,000 people were hospitalized for car accidents that year versus about 230,000 for some kind of issue with their medicines. So it's quite a big issue, but we talk a lot more about things like car accidents. So it's just important to draw some attention to that. I want to check with Bryony if there's any common mishaps that you see working in the hospital.
Yeah, so you've touched on a lot of them. And I was also going to say that this stuff is really complex, and you don't necessarily learn how to manage your medicines unless you come across it yourself or you're looking after someone who's taking medicines. So there's lots of things to learn and you may not quite understand, and we're going to go into a lot of it today. So C touched on a few of them. So accidentally taking too much of a medication, they might be doubling up on a medication. I've had patients who have come in who have been taking their spouse's medication because they went and got it collected at the pharmacy, just didn't quite realize it had someone else's name on it, and they just took it because they were taking quite a number of medications, and it just got popped in the box and you go, oh yeah, take one a day. So there's lots of those sorts of little things that you might feel a bit silly for doing, but actually it's really easy mistake to make, and that's why we can give you some strategies here today to help. Another one I was going to mention that comes up a bit is something you may have heard the term polypharmacy, so using multiple medications to treat different or the same indication, same condition. So you might have a chronic condition that you manage with your pain with medications, and then perhaps it gets a bit worse, so you go and get something from the pharmacy. You may not mention what you're already taking, or you forget because you're in pain or uncomfortable, and you're taking multiple things that may interact with each other, and you take it for a couple of days or weeks and then end up with side effects or unwanted effects that bring you into hospital. And it's only then when you realize, oh yeah, I did get that thing from the chemist recently and didn't check with my doctor or the other medicines I was taking. So it happens quite a lot.
And the stat that I've got noted down, there's something like 69% of these could have been prevented. So one of the reasons that we do these sessions.
Yeah.
Right. So to get into it, one of the first things you can do to keep yourself a bit safe is ask the right questions. So we often share the Choosing Wisely 5 questions, and I'll talk about those in a bit. But these are some that you could ask in your appointment or even to your pharmacist if you haven't got that information, to help you understand what you're taking, why you're taking it, and what you need to look out for. So the basics are things like, what's the brand name? Because that can be different to the active ingredient name. What's the active ingredient name, which is that sort of chemical name, the one that's hard to pronounce. What is it for? So which condition you're taking it for? Because if it's something that you expect will go away, you want to know that this is one you would expect to stop taking. When and how you should take it, what are the benefits, and what's going to change for you for the positive, what side effects you might expect or need to look out for. And you might want to ask what other treatment options there are, because medicines aren't always the right fit. There can be other things, diet and exercise, or even certain procedures that can help solve the problem. So we'll first talk about knowing the active ingredient. So an active ingredient is the chemical in a medicine that makes it work. Some medicines might have multiple active ingredients, but generally it's listed first on your prescription label now. I'll show you some examples. It's shown on the package, and there's often a brand name, so you don't want to get the two confused, or you want to be able to check for both. And the strength of those can vary, and it will say on the packaging. One of the things you can do, if you're not sure if something's a brand name or the active ingredient name, or just to get more information, is to jump onto the medicine finder on nps.org.au. And I will show you that one now. So can everyone see this? Excellent. So this tool, it's really simple, but it gives you a lot of the information you need about your medicines. So if I only know the brand name, so for example, Panadol's probably the one we're most familiar with, I would just say Panadol, if I can type, and it'll give you the different forms of that brand name. So a lot of us might take Panadol Osteo for arthritis. If we're older, or I myself take it as a young person, and it'll give you your result from Panadol Osteo. When you click into that, it gives you the brand name, which is usually the biggest one on the packaging. It'll give you that it's paracetamol. It'll tell you the schedule, which if it's an S3, it would be over the counter, an S4 would be a prescription. And then it has the full consumer medicines information, that tiny leaflet that's really hard to read. You can download that. You can download the large text version printed out so you've got it on hand, or it's got the whole thing typed out here, which is a really easy way to find the section you're looking for. So if I want to find out about the interactions, what if I'm taking other medicines? It'll take me to this section and says, tell your doctor or pharmacist, but also these are some ones that are known to interact. So it's a good place to check if you're unsure, you've got those questions, and also to work out what questions you want to ask your doctor. So any questions about this or what we've talked about so far? Okay, excellent. I'll switch back to my slideshow. Okay. Oh, if I don't click that again, there we go. I'll get Bryony to go through this, a bit of a scenario about what can happen if you don't know the active ingredient.
Yeah, so this slide shows a couple of different looking products, and you initially would think that they would be all different medications. Now, if you look closely, they are actually all containing the same medication, sertraline 50 milligrams. So Zoloft, you can see, was the original brand that came out, and then there are other generic brands of the same medication. And so you can see that they look very different. And if you've accidentally got, you know, one box when you're used to seeing the other one, you might think you've been put on a new medication. You can see how duplicates can happen when you're accidentally taking two of the same thing. And this can sometimes happen when pharmacies change the brand of a certain medication that they keep, and medication shortages are quite a problem at the moment worldwide, and we're certainly experiencing them here in Australia and, you know, at the hospital. So your normal pharmacy might normally keep one brand, but then they've had to change it, and if they haven't had that conversation with you, you may find yourself having a box of something that looks completely different. So this is what a good example of why it's so important to know the name of the actual medication, and in this case for all of those boxes is sertraline 50 milligrams.
Thanks for that, Bryony. And I've certainly run into this before, particularly with medication shortages where they just get switched out and you're not told. So it's a good idea to make sure you note down the active ingredient name so you can check. So I've put up a medication label here. This is just a box that we have lying around the office. And can anyone chime in to tell me, where's the brand name here? Is it the top one, the middle one, or is it the second one down, or is it elsewhere on the package? Beatrice? You're on mute.
Sorry about that. Can you hear me?
Yep.
Yeah. Is it the one that's underlined that says what 40 milligram? The telmisartan?
Yeah. So the brand name I'm asking about. Yeah.
So what was the question?
The question was, which one's the brand name?
Yeah, the telmisartan.
So that's what you might think, but it's actually the top.
Teltartan. Oh, okay.
Yeah. There's been a bit of a switch. I noted it down the bottom. It started a couple of years ago now, that now the label on your chemist label will have the active ingredient first. So this is what can trip a lot of people up, because the biggest one on the package, or the colorful one, is usually the brand name. And the active ingredient is the first one on your script label in most cases. Some pharmacies are a bit behind. We also have on the medicine label instructions. So how you might take the medicine. We'll talk a little bit later about these, but those aren't always standard across your pharmacy. So when you get those, it's a good idea to double check that you understood what they mean by that text. But usually this is the standard format your pharmacy labels will follow. Okay. So what about generic medicines? We've talked a bit about brand names and seeing those, and even generic medicines do technically have a brand name. But when we talk about generic medicines, we're talking about usually the cheaper versions. They might be the pharmacy own brand, those sorts of things. And for something to be considered a generic of a medicine, it's got to have the same dosage, the same intended use, the same effects, side effects, same method of administration. So you can't get a capsule where you should have had a tablet for it to be equivalent. They have the same sort of risks, safety and strength. So they're all tested really rigorously to meet these standards. Not all drugs have a generic version. There's some complexity around laws, patents, that sort of thing. But a lot of drugs that have been in the market for a long time will have a generic version. So if your pharmacist asks you, do you want the generic version? This is what they're saying and expecting this. However, you can have different brands with different active ingredients, things like that. And I'll get Bryony to explain this.
Yeah, so the little image there with the colors can show that it's not just the active ingredient that's in the medication. There are all sorts of filler ingredients, what are actually called excipients. So that might be colors, binding agents, things that make it stick together as an actual tablet. And those are the things that can differ when you're using a generic. However, the end result and what it does inside your body is still the same thing. So we know that they're safe to use, and in Australia, as C said, that they've been tested rigorously, so we know it's okay to use them. This example here with the tablets is a good one. So the top one at the top, the white round tablets, is a medication called fluvoxamine. And this is the original brand that was brought out. The brand name is Luvox. So these ones here at the hospital, for example, these cost us about $9 a box. Now, the middle picture, also white tablets, the brand name of those is Movox. They are the same medication, it's fluvoxamine, but it's a generic brand, and the generic brand name in this case is Movox. Now, these cost about $5 a box. Now, interestingly, you can see that they look exactly the same. The markings are the same, the size, the shape, everything is the same, and they're actually made by the same company. So they come out of the same factory with the same ingredients, the same recipe, for want of a better term, and it's the company, I guess, using it as an opportunity to have greater market share. They sell the original brand as well as a generic brand. So you know in this case that it's a bit cheaper, but it is actually the exact same thing. The third picture is the yellow tablets. Now these are made by a different company, and it's also a generic of the same medication. So again, it's fluvoxamine, 50 milligrams. And you can see that it's a yellow color, so it's a bit different. So the filler ingredient in this one is different, and that's part of why it's a generic and not the original. And so that differs slightly, but because it's been made in a slightly different way, these actually cost the hospital about $3 a box. So you can see how changing some of the way it's made can significantly change the price of it. And so certainly in a hospital setting where we've got a budget to manage and we're using public health funds, we choose, depending on what's available, but the most economical choice. And you can also apply that, and we'll talk about this a bit later on. Choosing a generic can often save you money. We know that it will do the exact same thing in your body, but there might be slight differences, and in this case it's the color.
Bryony, we just have a question.
There are examples though where you shouldn't use it. Yeah.
This is kind of jumping off the back of talking about those binding agents, so I just thought I'd jump in there. So the question is, a reason for using a brand name specifically would be a reaction to a non-active ingredient, like a gluten sensitivity or a binding agent or something similar?
Yeah, great question, Lena, and thanks for jumping in there, Darcy. And I was just about to say there are examples where you shouldn't use a generic. So there are either certain settings, so specific medications or diseases where you should stick to the brand that you have been prescribed. An example of that is warfarin, which is a blood thinner. You stay on the brand that you are prescribed because they can act slightly differently in your body. And exactly right, as the question said, sometimes people can have sensitivities or reactions to some of the binding agents or the fillers that are in them. So potentially it is a gluten or a lactose intolerance. And so some of those things can be present in the tablet. Often they're, say for the example of lactose intolerance, and I've had this question by people who are lactose intolerant, can they have a tablet if it contains lactose in it? In that case, it's a very tiny amount and it's most of the time absolutely fine. However, if you know that you are sensitive to a specific filler ingredient, then keep note of that. And you can see down the bottom of the slide and you'll see this on the CMI, which will go through the little leaflet of the information for the medication. It will list everything that is in that tablet. So if you specifically have sensitivities to certain ingredients, you can check each brand and know which ones to avoid. And then, of course, it's your choice to stick to the brand that you know that you like. And there are other reasons to stick to a certain brand, like we saw with the sertraline example. If you know it because that's the box and that's what you're used to and it helps you remember to take it, then that's also a reason where you're more than welcome to stick with the brand that you know.
I think I can see Daryl waving there. Daryl, have a question? Oh, sorry.
Okay, can you hear me?
Yeah, there you are.
Yeah. Just recently, they brought out a new thing for thyroid treatment, and I had a blood test taken shortly after, and it was different. The new one that come out doesn't have to be kept in the fridge, and it turns out that it's only, where it says it's 100 milligrams, it's actually only 80. So my GP got pretty excited and wrote letters and rang up the pharmacy, and both myself and my wife now are back on the original one.
Yes, great example, Daryl. That is a case where, so previously, the main medication we would use for thyroid conditions, levothyroxine, was kept in the fridge. The old brand name, I've forgotten it now. But the original ones are kept in the fridge. But then they brought out a new one called L-Troxin, and that didn't have to be kept in the fridge, which provides a bit of flexibility with remembering to take it because you can sit it with the rest of your medicines, or you can have it put in your Webster pack. But you're right, they weren't completely bioequivalent. So in that case, it wasn't technically a generic, it was actually a different type of medication. And so that's a decision that the doctor makes when they make the prescription. And if you choose to move over to that new type of medication, you're right, you'd need to have a bit of testing of your blood to make sure that your thyroid levels are okay once you're on the new medication. And then once you're stabilized, you can continue on taking the new one if it's more convenient for you, but also welcome to go back to the old one. But those, because it was technically not actually a generic, it was a different type of medication, that would be on prescription by the doctor, and those changes monitored by the doctor. It's a good example. Yeah.
Thanks, Bryony. Okay. So once we've asked, what's a brand name, what's the active ingredient, one of the other questions you might want to ask is, what are the likely benefits? And I wanted to sort of frame what we mean by that. So what are likely benefits for me? Pretty generic question, but what you might be asking is, will this reduce and relieve my symptoms? Is it reducing them, stopping the cause, or is it just relieving them? Will it cure my illness? Is it something that's going to actually fix things? Like, so a course of antibiotics might cure you of an infection short term, but certain other things, chronic illnesses, arthritis is my go-to example, you're really just relieving the symptoms and your medicines won't cure it, so you can expect to be on them for a long time. Is it to prevent complications for something? So one medicine I take has some pretty gross side effects, but I can take a vitamin supplement to make sure I have fewer of those. So that might be a reason for them. Or is it to prevent an illness? And if you go through these to work out why you might want to take a medicine, you can think about what benefits of those are important to you and whether taking this medicine is the right path for you, or if there are other alternatives, or even if there are other things you will also need to do, like investigating the causes, doing some other sort of treatment procedure, or starting something like an exercise routine to also relieve symptoms. So that's one really important question to ask. I want to check in with anyone who's happy to speak up. What sort of benefits are you looking for your medicines? How do you think through whether or not to take a medicine, or do you just take what the doctor gives you? If anyone wants to chime in. It's all right if not, but some of the things that I've had people talk about in the past are, so someone who's a bike rider, they are prescribed a medicine to manage their eczema, but that medicine means they're going to be photosensitive. So being in the sun, they're more likely to get sunburn. So it's really not a good fit for their lifestyle. And so they're thinking about, what are the benefits here? Well, it might help with my eczema, but it's kind of come at a cost. Are there other ways that we can prevent this? Is there a different medication? So if you think about what it's relieving versus what you want, it's a really good idea to work through that. Okay. Then we come from the benefits to side effects. So things like photosensitivity, that could be a side effect. Some medicines might make you a bit dizzy, or they might make you a bit fatigued. It's important to know that all medicines have side effects. You might not notice them, or they might not be particularly significant, but just about every medicine's going to have some kind of effect beyond the main sort of therapeutic benefit. So it's important to weigh up those possible side effects and how you need to work around them, or you might need to mitigate them with the likely benefits for them. And of course, be aware of the interactions with medicines. So you can use the consumer medicines information, and we can go back and have a look at where that is in a moment. And you can use the medicine finder if you're thinking about taking medicine to have a look at what the possible side effects are. Bryony, we had a couple of questions about medication interactions, but also interactions with food and drink. And I just wanted to see if you had any answers for that.
Yeah, certainly. So, and also just to touch on the side effects, when you do look at them, look at the consumer medicines information leaflet and you look at all the side effects, my goodness, there can be a lot, and it can be really overwhelming. So it's important to put some of it into perspective. Now, the companies who make the medications have to list every possible side effect that's ever been reported. So it's so important to remember that they're not all going to happen to you. And there are ways of breaking down what are more common and what are more rare side effects. And even when we say that something is a common side effect, it generally means that it can affect between 1 in 10 people and up to 1 in 100 people. So even for something that's termed a common side effect, it may be affecting one person out of 100, but that's 99 people who are not affected. So it's good to be aware of them, and certainly to keep it in mind if you do experience a side effect, but also important to take it into perspective and not let it necessarily put you off taking a medication that you may really need. And actually, I was also just going to say that a lot of the side effects are usually pretty mild and will go away when you've either finished the course of medication, if it's a short course, or after you've been taking it for a period of time. Your body can often get used to it, or the side effects settles down. So sometimes it's just a matter of waiting and managing. Now, that doesn't mean suffering. It's certainly speak to your doctor or pharmacist about what's happening and how to manage it, but sometimes it's reassuring to know that a certain side effect may go away over time. So some of the questions we had were interactions with food and drink, which can be a bit of a funny one, and some of you may notice that sometimes if you've got a medication, and a common one is atorvastatin or Lipitor, it's a medication that we use for cholesterol management, it gets a little green a little bright label stuck on it saying interacts with grapefruit juice. And it can be a bit of a strange one. We do know that the grapefruit juice changes the way that our body processes the medication. And in that particular example, you can end up with a higher amount of the medication in your body than you need to. So that is one instance where it's recommended to not have the combination. However, it's always worth a conversation with your doctor or pharmacist about that specific medication and your specific scenario. So there's always nuances in those settings. One of the other things when we talk about food and drink that is a bit more, I guess, real or tangible is that some medications are just not absorbed properly if there's food in your tummy or if there's the wrong type of food. So there was a question that we had about blood pressure medications, taking them on an empty stomach or with food in your stomach. Most blood pressure medications, it doesn't matter. However, there's one, and this is not technically a blood pressure medication, but there's one called Sotalol that we do use for heart rhythm problems, and that should be taken on an empty stomach. So that should be on the label from the pharmacy, and it certainly would be in the consumer medicines information leaflet to be taken 2 hours before food. So there are settings like that where it helps, depending on the food, presence with food, helps to either absorb or, to get the best benefit out of the medication. Were there any other questions about side effects or interactions with food and drink? We'll talk a bit more about interactions with other medicines and how to work that out a bit later on, I think.
Yeah, well, I mean, we can start digging into interactions with other medicines, because I'll show people where to find this on the paper form. So this is just a diagram of what a standard consumer medicines leaflet should look like, the one you get in the pack. And I'll jump over to what we were looking at earlier and show you as well. But roughly all of them will have this same part. It's a really standardized document. So it will have the brand name at the top, then the active ingredient below it. What to do if you miss a dose is a key piece of information they have on there. They talk about things like storage, so safe temperatures, what to do if you have leftover medicines. Some of them need to be disposed in a certain way, and it will include those sort of filler ingredients as well. So we'll go to Panadol Osteo, and now it will show me. So you can download this as a PDF file, but this is the tiny, tiny print document that we get folded up in most of our medication packets. And so you can see it'll have what is in this leaflet, what it's used for, and all those sections that I showed you on the diagram. If we get down here, we've got the side effects, Panadol Osteo, and it will say, yeah, do not be alarmed by the following list. These are rare. You may not experience any of them. And that disclaimer is pretty standard to remind people. But it'll tell you if any of the following happen, when you might stop. So for Panadol, it says if you experience shortness of breath, wheezing, go to the next page, swelling of the face or a rash, then stop taking it immediately and go to emergency. So it's a good thing to have a read through these and see, because it'll tell you these are the ones to watch for, just in case. It should have, here we go. If we go up here, it has this section called Before You Use, whatever drug it is. And using other medicines is where you'll find the information about interactions. This one doesn't have any about food, but it will also have the information about food. And it has information about how to take it. So whether you can crush it up, those sorts of things. So Bryony, can you talk a bit more about interactions?
Yeah, certainly was going to absolutely how it lists the other medications that you should use with caution or not use. When it's listed in that medication in the CMI leaflet, it can be quite broad and it can often contain a lot of things, and you might get home and read it and think, oh, well, I am taking that. Now, sometimes there are scenarios where that's okay, but it should definitely be a conversation with your doctor or pharmacist. And ideally, your doctor or pharmacist would have already pointed that out to you. And certainly when I'm giving out a CMI for a new medication and it will list another medication that the patient may be taking. I like to point it out and say, look, this is listed as a precaution, but in your unique setting, we've taken that into consideration. These are the risks and benefits, and I'll explain the reason why you're taking both of those. So that's one thing to remember, to not read that and go, oh, okay, gosh, I won't take it at all, because there may have been a reason for it. So this is an excellent resource to use and to refer to, but often it's a good starting point to then have a conversation with your doctor or your pharmacist about that. And then in terms of, interactions with other medications, it's also very important to remember what things that you may not think of with medicines. Like we talked about before, creams, patches, eye drops, injections that you have into the skin. Maybe it's an injection only once every 6 months. There are some things that you forget that you might be taking and you haven't mentioned it to, maybe it's a new GP, or maybe it's a pharmacy they don't normally go to. So it can be useful to even have a little list of everything that you take. Keep that in mind when starting a new medication, because you can then compare against a list of medicines that should be cautioned. So the pharmacist can go through with you about interactions and how to either manage them or to avoid, or whether it needs to be a new choice of medication. I think that has covered it. And then there are also ways of checking, and C had showed us before on the NPS website, you can check for interactions as well.
Thank you very much, Bryony. Okay, we'll get back to PowerPoint. Here we go. All right, so this is the core diagram, and that should help you read through these in future. The next question on our giant list is how I take the medicine and how long. And a lot of people just think that they'll get the label and it will tell them how to take it. But there can be a bit of nuance to it. So you want to know how to take it. So that may be something on the label, take a tablet, but do you need to take it whole? Can you crush it? Is it something you dissolve like a lozenge? So it's important to ask your doctor and make sure you understand that. For something like an injection or a suppository, you might even want them to show you how to use it. And a lot of doctors and pharmacists are happy to do that because it makes sure that you get the medicine and make sure that you've taken it to get the full benefit. One of the best things when I started having to do injections myself was I was sent a bunch of videos, and one of their nurse practitioners made an appointment with me to sit down and show me physically how to do it. And often GPs will have someone available to help you learn how to do things like that. You can ask for written instructions, pictures, those sorts of things, and a lot of those are available to doctors and pharmacists to print off and give to you. And of course, any concerns about the method that is taking it. So if you're scared of needles, taking an injection can take a lot to work up to. There might be another option like an auto injector that might be better than a syringe for you. Those sorts of things, it's important to discuss up front because it's important that you take the medicine as directed. And if there's anything that'll interfere with that, they want to know. You also want to know how long you've got to take a medicine for. Is it a one-off? Is it a day, week, month? Is it a short course of antibiotics first? Something you'll need to take once or twice a day ongoing? Is it something that you will need to take forever, or you'll expect to come off at a later date? It's important to know that when you commence medicine. We did have a couple of questions about how you take medicines. One of them was about coated versus uncoated tablets and what effect that has. And can you cut all pills? And that sort of ties in with the coated versus uncoated.
Yeah, definitely. So with this example, there are certainly medications that can be halved if it's a big size and you find it difficult to swallow, or if your dose is meant to be half, the size that the tablet comes in. There are certainly a lot of medications that can be halved, quartered, crushed. However, very important to check each time that you are meant to be taking it in that way. Back to the CMI, it will have how to take the medication, and usually, like quite often, for example, with the Panadol Osteo, it will say swallow whole with a glass of water. Sometimes these directions can be a bit more detailed, and it might be in relation to food or anything like that. Often the CMI won't necessarily say you can crush this or you can halve this, but that's certainly a question that you can ask your doctor at the point of having it prescribed, or the pharmacist when you pick it up. Certainly for people who have swallowing difficulties, or they have to take their medications in different ways, we will be able to provide advice on how to crush a medication and mix it with a certain fluid to ensure that someone's able to swallow it properly. So there are often lots of different options, but I guess if you're wondering about yours, the first point would be to look at the CMI and say if it says, swallow whole or not, and then depending on the situation, if you do want to explore other ways of taking it, to ask your pharmacist if you're not sure, because yeah, it can be a bit tricky to know. Some have special coatings, and some even slow release tablets, which usually need to be taken whole, swallowed whole. There are some special formulated slow release tablets which actually can be halved, so it can be difficult to know, and your pharmacist is probably the best person to ask for those sorts of questions. I'm happy to answer any specific ones if people have in the chat or afterwards, but yeah, it can be varied from medicine to medicine.
One of the other questions we had was around the best time of day to take certain medicines, and you might have a recommendation about a time of day. Could you tell us a bit about that? Yeah,
look, it depends again on the type of medicine. Certainly a lot of them will be very specific, and it will say it on the label, and it should say it on the label. But say, for example, if it's a once daily blood pressure medication, usually in that example, it doesn't matter what time of the day, but we always tend with that setting is to take it at roughly the same time each day. And that's so you have a predictable response in your body with the medicine, but also so you remember to take it. Like if you're taking something and it only needs to be taken one time a day, if you take it sometimes at morning tea or sometimes at bedtimes, it just makes it harder to make sure that you've taken it, and you may get to the end of the day and go, oh, did I have that? So usually at the same time each day for once daily medications, and then otherwise if something's taken multiple times throughout the day, just to check the times on the label. And also wanted to mention, for you as consumers, please feel empowered at the pharmacy or at the doctor to check the directions and understand and make sure you get it, because sometimes the directions aren't clear. And as C was mentioning, the way the labels are presented are not necessarily standardized. We've done some work here at the hospital to try and make our labels a bit more clear. But at the point where you first pick up that medication, it's good to, if it's in a little basket at the pharmacy or in a bag of medications at the hospital, to have a look at it, read it yourself and check that you understand. And if not, then to ask the question, because sometimes something that makes sense in the head of the doctor or pharmacist may not be clear to the person who's actually taking it. So please feel free to ask those questions.
Yeah. One of the questions in the chat is from Lena about, she says, I really struggle with as required medications. What sort of questions should people be asking to manage those and make sure they understand when to take them? Yeah,
excellent example. And sometimes we even get prescriptions, when I worked in the community, from doctors that just say, as directed by your doctor, and you ask the person and they say, what did the doctor say? They said, oh, they didn't. So yeah, I can appreciate that this can be really confusing. So as required is usually something that's taken for symptoms that might not be there all the time. I'll use the example of pain relief. So something like Panadol Osteo, because it's the Osteo version, is usually taken by people who need to take regular paracetamol throughout the day, and it's the slow release form, and you can take it 3 times throughout the day. If you're taking regular paracetamol and you have an injury or something, and you've got, say, back pain, and you've been prescribed a medication for the back pain and it's to be taken as required, that really should say, what we mean is, if you have pain, take 1 of these or 2 of these, whatever the directions is. I guess, again, it's quite specific for each medication. And if you've been given something by a doctor that says as required, it's important to check what they mean by that, so you feel confident and you know what it should say. And then, you know, you can always write that on the label yourself to remind yourself, or then and also to double check with the pharmacist at the time of getting it. So it's a bit of a vague answer, I'm sorry, but I guess it depends on exactly what the medication is and what the as required was for, what it has been prescribed for.
So it's really about talking to your doctor about, so when I have pain, do I take it then? Or if I'm expecting to do something in the next few days, take it as a prevention? It's about asking those questions, is it?
Exactly. And if it's, say, something like a cream, like the example with the eczema before, if you have a flare up of your eczema or skin condition, you might have a cream that's just taken as required. So yeah, just to clarify with the doctor who's prescribing it, what that actually means. Do I use it a few times a day for a week and then do I stop? Or is it just use it as a one-off as required, when's required? So yeah, it comes back to that conversation with the doctor. And yeah, encourage you all to, at the point of getting the prescription or getting the box of medicine, to look at it and try and ask those questions then when it's fresh in your mind.
Excellent. Right, thank you. And that does sort of lead into the next slide, which is, how will I know if the medicine is working? Because this is the question that a lot of us skip over. We want to get it, we've been rushed through the appointment, but we don't necessarily ask, how will I know if it's working? We expect it might fix our problem, but what does that mean? So some might be immediate reactions like pain relief, you probably feel it. But some might take 2 to 3 weeks to kick in. You might have a period of some side effects as it's starting. So antidepressants are a classic example where starting them can be a little rocky. And it's important to ask that, well, how will I know it's working? What should I look out for? Should I be tracking my symptoms in some way to make sure that whatever you've been prescribed is working? So within that, ask, how quickly will it start working? Is it in the next half hour? Is it in a few weeks? How will I know that it's working? What should I look out for? We'll only know when we get blood tests, those sorts of things. And when should I come back for a review of how well it's working? And I'd also add on to that, and what information do you want from me at that time? Is it that you just need my blood test results, or do you want me to be keeping an eye on the symptoms as well? Because some doctors find it helpful for you to fill in a little chart and that sort of thing. Okay. Right. Wow. That slide's a little bit closer to where I thought. So I'll stop and just check if anyone has any questions to ask before we move on to costs. All right. So the costs of medicines is another thing that often comes up. And I just want to talk a little bit about the PBS safety net. So the PBS safety net is, well, the PBS and the safety net. So the PBS is the Pharmaceutical Benefits Scheme, and it's a register of all the medicines in Australia that the government will subsidise. So that means that you get your prescription costs. It's now standardised at $30 per script for most people, or $7.30 for concessions. And so if a medicine is on that means you'll get that subsidy. If it's not, then you might have to pay a lot more for it. So some medicines can be hundreds of dollars or even more. And that's where you might need to think about talking to your private health insurer if you have one. But within the PBS, there's this thing called the safety net. And so it limits how much money you spend per year on these medicines, because everyone shouldn't be spending thousands of dollars where possible. And you can ask your pharmacist to keep a record or even combine the amounts on this for your family, so that government knows this household has spent this much on medicines. Once you hit a certain threshold, you'll get a discount for the rest of the year, or some medicines will even be free. So you can get a prescription record form, which is a paper or digital form, usually paper, if you go to more than one pharmacy, or if you just see one and all your family goes to one, you can ask them to keep that record for you. One thing that I've encountered is that whilst I see two different pharmacies, because I've got one very specific medicine, my main pharmacy will call them to make sure that they've got the up-to-date record, so I don't have to worry about it. And a lot of pharmacists will do that sort of thing. Once you reach that threshold, you do need to ask to get this safety net card, and that's what will give you a sort of reference number so that you can get the discount. And I've just got the updated figures because there was a bit of a big change this year in that now general patients, your prescriptions should be down to $30, whereas it used to be about $42 something. Concession card holders, it's gone up a little bit to $7.30. But the safety net thresholds, so $262-ish for concession cards. So if they spend up to that amount, for the rest of the year, all your prescriptions are free. For general patients, it's $1,560 something. And for the rest of the year, if you hit that threshold, your medicines are now $7.30 each prescription, which is a pretty significant change and can save you a lot of money. So if you're not tracking that, it's something I really recommend you discuss with your pharmacist. Some other ways to save money on medicines. Bryony, could you go through this one?
Yeah, so yeah, in addition to the safety net, which is an excellent thing to keep in mind, there are other ways you can save money with your medicines. So one of the ones is combination products. So a lot of medications, and increasingly more medications, are becoming available in combination with other medicines. So it's usually standard combinations like blood pressure and different types of blood pressure medications. Quite a lot of the diabetes medications are now combined into multiples, where they combined 2 or even sometimes 3 medications in one tablet form. So this means that instead of paying the co-payment, the PBS co-payment 3 times or 2 times, you're only paying it once. So that's a useful way of saving money, and your GP will be able to work out if the medicines that you take fit the standard combinations that are available, and that will depend on what dose you're on and what type of medication you're on. But it's certainly worth a question, and it may not be something at the forefront of your GP's mind. They may just hit, repeat prescription. So it's worth asking the question if you're not sure if you could be taking a combination. Another one is potentially if you're on a higher dose is taking a higher dose medication and halving the tablet. So again, this is what we were talking about before. Very important to check that it is a safe and appropriate medication to halve, but it may mean that you get twice the amount of time out of one box of medicine. So say your dose of a medication is 2.5 milligrams, and you normally get the 2.5 milligram strength. You may be able to get the 5 milligram strength, cut it in half, and then just take half, on one day, half the next. And that way you'll extend that box or bottle of medicines. But that one is, as I said, very specific, and you'd need to check that it's safe and appropriate to do so, that it's going to still work in the right way. And then for things that are not on the PBS, so as C mentioned, there are some things that can be hundreds and even thousands of dollars if they're not on the PBS, and that's what we would call a private prescription, is to shop around. Some pharmacies will do a better price. You could ask your pharmacist to price match. They may be willing to if they're wanting to keep your business. So there's also, it's also worth shopping around to see the best price you can. One thing to remember if you're using multiple pharmacies though, is to keep that in mind, that your regular pharmacist who you get all your medicines from may not know that you're taking another medicine from another pharmacy. So remind them of that if you're starting a new medication, and they need to take that into consideration with, in terms of interactions and that sort of thing. And then again, as we talked about earlier, the generic, quite often the generic will be a cheaper option for you. And we know that it is safe and effective and does the same thing. So as long as you don't have any side effects to some of the filler ingredients, which is quite rare, and as long as you're comfortable with using the generic box of medicine and you're still familiar with what it is and what you're taking it for, and you're not getting confused, then that's a great way of saving money as well.
Thank you very much. All right. So now I'll start to get into keeping track of your medicine. So you've asked all your questions, you've got what you need. How do you keep track of it all? Especially if you're seeing multiple pharmacies, it can be quite difficult. So we've got a few different tools depending on how you work, whether you're a paper person or an app person, and we'll share a few of them. So there's medicines lists, so you can get a physical list. A lot of pharmacies will have a template in store, or you can download a template off the MPS website, or you can use things like apps. There's also medication organizers. So a Webster Pack's one a lot of people are familiar with, and I'll show you a few of the different ones. You can use reminders on your phone, or even I use them on my smartwatch to help you keep track of when to take medicines and check off that you have. And we'll also talk a little bit about My Health Record and digital health records for keeping track. It's really important to keep these lists and keep track so that you know that you've taken your medication, that you're keeping up with your scripts, and taking that list to your doctor and your pharmacy so they know everything you're taking. If you've got one sort of source of truth, so I keep mine in an app, and it's the same list that I give to every professional I talk to. So it's really important to keep track. So the first thing we'll talk about here are different sort of physical organizers. So the Webster Pack is a big one that most people are familiar with. And it's just my slides have gotten a little jumbled. So there's the Webster Packs here. There's also these things, most pharmacists I know call them dosettes, but they're the little medicine organizers in the bottom corner here, which might have days and times on them. And then there's these things called a tab timer. And a tab timer is a cool little device that can be on the NDIS if you're an NDIS user, that can help you to set times for your medicines, and it'll automatically spit them out. Bryony, could you talk a bit about how people use these in your experience?
So all of the different ones? Yeah. So Webster Packs is probably the most common one I see in my setting, and most pharmacies will be able to set you up with a Webster Pack. There's usually a small fee per pack. It's about $5 or $6, and it can be a really great way of just remembering that everything is in there. You know that it's all of the things that you need, and you just remember to take it at morning, lunch, dinner, or whenever your times are. The other one is the dosette box, and some pharmacies do pack a dosette box, but we more commonly see people using those at home themselves. And you might set usually they're a week at a time, so you might set Sunday afternoon, you sit down and pop out all of your medications into the right sections for you to take for the rest of the week. Now these things you might associate with when you're getting older and you're taking more medicines, but I use a dosette box myself for my vitamins and the few other things that I take. And even as a pharmacist, I find it quite hard to remember to take all the things I need to take. So I find it as a great way of just remembering. It's nice and easy. It's just there ready to go, and I only have to fill it up once a week. One of the things with the Webster Packs, though, we do find that you're handing that over to your pharmacist essentially, so that we can see sometimes a bit of a loss in your own knowledge of what's in the pack. Now that doesn't have to happen, and I'd still encourage everyone, whether you're using a Webster Pack or not, is to be aware of what you're taking at what times, to check it for yourself, but also so you're aware of it. And on the back of a Webster Pack, it will actually list everything that's in there and at what times. So that's still a way that you can stay up to date in your mind and remember what you're taking. And that can also help you at times if there have been changes, or you have to have a few days of not having one certain medication, which one it is to avoid it. I mean, those sorts of things always need to be done in consultation with your GP or pharmacist. But although some people find that they lose a bit of their independence with their medicines by using a Webster Pack, it doesn't have to be the way, and you can still be aware of what's in your pack and what should be there and when you're taking it. Now the tab timers, I've not actually used them much, and they seem like an excellent resource, but I'd love to see it. Have you come across them yourself, C?
I've seen a few people who use them, and I've got the giant version up there, but you can get smaller ones as well. And the good thing about the tab timers is they have a spare tray, which is what you can give to your pharmacist. They can fill the way they would a Webster pack to chuck back on. So there's a pretty extensive selection of them online. B, have you got a question?
Yeah, I was going to say about the tab timers. In my past life as a a home carer and coordinator, so a couple of my clients came to us before they received their package, and they actually had theirs. The issue was that because they make a beep sound, they alert the client or the person taking the medication when that it's time to take medication. But unfortunately, both times that I've ever dealt with them, the client had developed a dementia, and they had no idea where this beeping was coming from, what it was about. And then when they saw that when they saw this thing and it was making funny noises and they couldn't stop it, they actually damaged it and broke it. And these things are a couple of $100s each. They're not cheap. So it's very important, from my history, from my knowledge, that you need to be aware. You've got to take into consideration whether the person has a dementia or not, or is developing a dementia. It just reminded me of that as my time there. I haven't seen them since, actually.
I think it's a great example, and it's reminded me that there are other considerations, even with things like Webster packs. Sometimes you pop them out like you would a normal tablet from a blister pack, but then sometimes you need to turn it over and peel the little label back. And some of these things, actually, to access your medicine in the Webster pack, you might not be appropriate for someone who has poor dexterity in their fingers, or if they've got low vision. So similar to your example with the tab timer, with each medication aid, we would call it, it needs to be considered for the individual person in front of them and make sure that it's going to be useful.
Yeah, and with the Webster pack, with the Webster pack in my role, we actually had to have them locked away in like a little toiletries bag, and the staff used to have to go in there and sign off on medication list that they were handing those medications over to the client, because they could not remember, or they would start taking a whole day's worth, or not the right day, not the right time, there'd be stuff everywhere, and then we'd have to sort of fill in for that. So when you've got them like this, it's good to have them, because it takes the onus off the client to do that, but it also, you have to have somebody that's able to pass out that medication properly. We had to do a lot of training with our pharmacists or our clients at that stage.
And I mean, this is a really good demonstration of that. These are all options, and it needs to be fit for your specific purpose. So these are just a selection, and they might suit you, they might not. I have really long nails, and so a Webster pack does not work for me. But you can get really fancy little purses that have days and little zip bags, which are much easier if you've got fake nails or whatever, and they look like a chic little purse. And those sort of options are out there. So it's worth having a look, thinking about what you need. And I know that even Tab Timers started doing silent versions of a lot of their little models because of feedback like that. So have a look around. These are just a few of the options. Think about what's going to work for your circumstances, because organizing these things can really help lower your risk of accidentally taking the wrong dose or something else. I want to talk a little bit about smartphone apps, because even if we've got these things physically organized, remembering them, keeping track of scripts can be really complicated and take a lot of brain space. So there are a lot more apps than there used to be for organizing a medication. And most of them will do these main things, which is record all the medicines you currently use, ideally, what each medicine is for, is usual information, how much you're taking, when and how, and you've got to really, you may need to keep it up to date yourself, but it's worth checking if there's an app that can be automatically updated. So A lot of pharmacies are now using e-scripts, or your doctor may be giving you e-scripts, which come as little QR codes. And those you may be able to submit directly to an app. There are some out there that different chemists use, and if they've been approved by the Digital Health Agency, then you may be able to manage your scripts, submit them in there, organize delivery, but also that way you don't have to keep track of them. Another thing to ask your pharmacist about is something called an active script list, which is an online version of all your scripts that they can see and your doctor can send scripts to, and it will automatically update your repeats. But again, it depends on how comfortable you are with technology and whether your doctors are already doing this system. The other great thing about smartphone apps is once you've worked out whether you're the one to keep it up to date or it's automatic, you can carry it with you and you'll always have an up-to-date list of your medicines. So my pharmacy app is just now my go-to to say, these are my medicines. And so I'll sit in the doctor's appointment, pull it up and go, I need a script for this, this, and this. It makes it a lot easier to keep track of those. The example I've got here is the MPS MedicineWise app, which is not connected to any pharmacy and is funded by the federal government. So that's one option. There's also MedAdvisor, which is used by capital chemists in the area. I believe Priceline has their own app as well. So good to have a look around, see what your pharmacy might use and whether it might work for you if you're a tech person. The other good thing about these is often they'll have a carer mode. So if you're managing medicines for a few people, so kids, spouse, someone that you want to keep an eye on, you can switch into a different mode and see all of their medicines as well. And most of them will let you set reminders for yourself and for those people. I'll try and go over these fairly quickly because a lot of these apps and systems feed back into the federal My Health record, which you may or may not have depending. A lot of people did opt out of this initially because of security concerns, but it is still being used. And what you can do if you do have a My Health record, which you access through MyGov, is log in and put in your own list of medicines. And that means that there's a one source that if you turn up in any Australian public hospital, they can get to your My Health record. If you see a new GP, they can get to your My Health record. And these days, pharmacists also have some access to it. That's been one of the big changes with COVID. So they can see the medicine list that you've popped in and any relevant history. So it really gives high level health information. It won't have everything about you in there and you can opt out anytime if you're worried, but it's a good idea to add your medicines list, particularly if you're traveling. If something happens, someone will be able to see what medicines you're on. To add to a little bit of the confusion, we do now have a digital health record in the ACT, which has a very similar name, but it's not the same as My Health record. So the digital health record is this new system in the ACT public health system where they keep all your health records from public health services here, things like test results, health summaries, even your advanced care plan. But it will also, you can see a list of medicines that they have recorded, so you can check that it's correct. You can't currently edit it yourself from their app, but you can see if they've got the right ones recorded and updated. So it's a good idea to have a look at this, and Darcy's dropped a couple of links in the chat so you can have a look. Bryony, you're living this. Do you have any comments on the digital health record and how it's being used?
Yeah, so I'll just firstly mention about My Health record, which has been around longer than DHR, and was just going to mention that for us in hospital, it can be an excellent resource to use if you're happy to have your information shared on it. When people come into hospital, they can be sick, very unwell, not thinking straight, sometimes not even actually be conscious. And so for us in that very acute setting where we're trying to work out what's happened to a person and what's wrong with them, for us to be able to log on and have a look at what medicines they take is invaluable. So that's one of the real world settings where the applications where we see it being used. And while we'll always then speak to the patient, speak to the family, the GP, to confirm what's being taken, it can be a great starting point for us to kick off your healthcare and making sure we're getting you, as best, back to health as soon as we can. In terms of DHR, yeah, look, it's been a whirlwind. We went live in November. I'm sure most of you would have seen all of the advertising across various health settings across the ACT. All the hospitals went live at the same time. It was about 3 a.m. One night in November when we switched over from using our paper charts to using DHR. And it's been a steep learning curve. We're all becoming more familiar with this online setting that we're using for all of our records, notes, medication charts, everything that we would previously have done in a paper setting is now on computer. And while it takes time to learn a new system, and we had lots of training, it's still always a bit different than when you're actually on the ground. We're starting to see the benefits now where, there's so much available in there and so much that we can access, and also so much that you as a healthcare consumer can upload to it and see yourself. So it's been useful. It won't necessarily say that it's been hugely smooth. I mean, we're getting there, we're learning it, but it will be a great thing in the future for us to use. And it's a great way of sharing the information across us and for you as a consumer as well.
So thank you, Bryony. It's certainly been an interesting one to be on the consumer side of, and these things are getting improved all the time. So have a look on the links that Darcy's dropped in the chat for us. Okay, I wanted to stop now to ask about your tips. So what have you found that works for you when managing your medicines? Beck gave us some great examples of what might not work, what you might need to think about. And I'll just stop and check in with folks. Anyone got any top tips? Beck?
Yeah, I do use an app. I have used My Chemist, and that app works really well. It keeps me up to date with the medications that I need. I also do have a little medication tablet box that I put all my meds in every fortnight. It's a fortnightly thing, and that sort of keeps me up to date with how much meds I've got left over when I need to refill the script, and seeing my doctor every few months to have those keep those scripts going if I need them. That seems to work well for me.
Excellent, thank you. And it's good to hear where these work in the real world. You've heard a few of my tips around the secret purse that's good for my nails, but things like apps are certainly one of the things that I get the most positive response about talking to people. That they can help you keep you reminded. But the tip that I learned from someone was to put my medication reminders on my smartwatch, because that's always on me and my phone's across the room. It'll buzz for me. So that's another one. If you think of any, pop them in the chat. Okay, so we're in the home run. We're nearly there. Do stop us if you've got any questions. I wanted to cover, now that we've know what questions to ask, we've got the right meds for us, and we're managing those ourselves. You have a few tools at your disposal if you're not sure that something is right or if you've had a significant change. So there are medication reviews that you can get done with your pharmacist. And first one is called a meds check, which if you've got 5 or more prescription medicines or a recent medical event, you can go and talk to your pharmacist and make an appointment to do one of these. And it's a one-on-one sort of appointment with the pharmacist in the pharmacy, and they'll review all your medicines and discuss ways to manage them, see if they're still the right one. That might be where you spot, oh, this could be a combined one. And that's a really good way for you to get a better understanding of medicines overall, particularly if you might be, say, having a side effect, but you don't know what it's from. And you'll come out of that with a bit of an action plan. So that's one thing, and you can just pop by a pharmacist and do that. The other kind of meds review is a bit more in depth. It's the home medicines review, and your doctor refers you for this. So again, might be a big medical event or you're on a lot of medicines, and a pharmacist can come to your home, which can be really helpful for making sure you're storing things properly, checking about, expired meds, getting those cleared out. And they'll review how things are at home. So I know that some people, it'll be them and their carer do one of these together, so their carer understands what's going on. And again, it'll give you a better understanding of medicines, ensure they're working for you, and how you're storing them in home. And they'll send that review to your doctor, so they have some documentation as well. And it might lead to a medication management plan, which can help you manage some more complex stuff. Bryony, did you have anything to say on these in particular?
I think you've covered it beautifully. Yeah, I think the main thing is to know that they're available freely in the community, and the meds check certainly is easy to book in. You do usually need to make an appointment, and it can be useful to bring in all of your medicines, even over the counter things that you may have had from other pharmacies, and you can sit down and have a chat with the pharmacist about it. You don't need to bring them in, but you can do that. And it's, they're right there. It's an easily accessible resource. And it means that the pharmacist has put aside time, they've booked you in, because pharmacies can be busy places and there can be lots of people standing around, and you might have all these questions but feel like, the pharmacist is in a rush. But if you book in a meds check, then it should be conducted it's usually conducted in like a little office or a separate part of the pharmacy where you can sit down and spend that time talking through, and you can raise all the questions. I'd recommend writing a list of your questions like we've been talking about and taking those, because it's easy to forget the questions that you had in your mind when you're then sitting there. And then the HMR, yeah, so we see these, as C said, they're a more complex investigation of your medicines, and that can also be really valuable for the pharmacist to come in and see how you're managing at home, because, you might have, in terms of exactly as C said, where you're storing your medicines or how you've got them set up, all of that forms a picture for us as the pharmacist to make a review and give some recommendations to your GP, and then also to give you advice on how you could be potentially managing things a bit better or in a different way, to avoid side effects or save money, or just, optimize everything in terms of your healthcare.
And one thing I've seen about the stats around these is that they're just not used as much as they should be. So really, it's worth, if you haven't had one done before and you're on a lot of medicines, have a look at just booking in a meds check, because it can answer a lot of questions you just might not have had time to. All right. So what do you do if you are having a side effect? There is, of course, you've got to seek medical care first, but if you want to report it, there's a specific process for doing that. So the government does record side effects and adverse events, and that includes medicines, vaccines, including prescription and complementary. Of course, speak to your health professional as soon as possible, even if it's calling Health Direct, which is a nurse practitioner run number, and I've certainly done it in the past. But if you've got a side effect, it's a good idea to report it on the TGA website or give them a call at this number. And on this phone line, they can give you a little bit of advice about what to do. They're not there to provide treatment or anything, but they can give you some advice about what to do about this side effect. And that way they have a record of these side effects going forward. So there's a giant database that tells us exactly what's gone wrong. If you've got unwanted medicines, and this might be from your own thing, might come out of your meds review, you really shouldn't take your medicines if they're past the use-by date. Those use-by dates are set at when a medicine's reducing in its effectiveness. So by the time they're expired, they might not work, or they might have some more side effects. So check if you really need them. If something's expired, it might mean that you don't need to take it anymore. So discuss that with your doctor. But also you can return unused medicines to your local pharmacy. They have a rum bin, which sounds really fun, but it's just a bin for all your unwanted medicines, anything expired, even just that you don't need anymore. One note with those is they can't take sharps, so things like needles, and certain medications, so Schedule 8 medicines, opiate painkillers, or like ADHD medications, so like dexamphetamine, you might need to sign a form if you're dropping those off, so they can make sure no one can take advantage of those. So really important to get rid of those. And one of the reasons is you don't want extra medicines lying around because they look a lot like lollies. This is actually from Bryony and colleague Sarah. So.
Yeah, sorry, my internet just dropped out a little bit. Yes, so this is an example. This is an activity that we did a couple of years ago here at the hospital as part of an education event. And it shows really why it's important to dispose of medications safely and to store them safely, because as you look down, you can see that the first one there, the Mentos, the purple Mentos, looks very similar to the sodium valproate, which is used for epilepsy or mood disorders. Similarly, the warfarin tablet, the little purple one next, looks just like a warhead, which, you know, and warfarin is a very serious medication that is a blood thinner, and if it were taken by a small child or anyone who's not prescribed it, could have very serious side effects. So this, I think, was a really great little example that we did, and it's a good highlight for not only everyday people in the community but for health professionals as well, just to realize that, yeah, a lot of medicines look like delicious, fun lollies, and to a child or to a pet, or if they're stored in the wrong way, can have very serious side effects. So just a good reminder to keep your medicine stored up high, away from children and pets, and when you finish with them, or as Sia was saying, when you're no longer using them, to return them to the pharmacy, not just to put them in the bin, because the bin may get accessed by a child or a pet or someone. So to make sure that they're disposed of properly.
Thank you. Okay, so this is one of the last things I'll show you. These are some sources that can help. I showed you the MPS MedicineWise search earlier, and they have a whole range of information, including paper forms to keep track of your medicines, but also guides for different kinds of chronic conditions. So really worth having a poke around on there. There's also something called Medicine Line, which is the phone number's on here, but it's 1300 medicine. I've got it typed incorrect there. And they can give you more information on medicines. Health Direct is a really great one. So I've called them when I'm having a side effect. It's the middle of the night, no GP, and they'll just tell me how serious it is, whether it's, you need to go to ED or call your GP tomorrow. And their website has a lot of information about this, about different medicines. It's adding more all the time. And that includes information about other services like My Health Record. So there's medicine info, information about the health system, and you can even find a health service on there. So it's a really good one. But I've got down and boiled down, but always go back to your pharmacist or your doctor to get more info. So thank you. There are my details if you have any more questions, but we've got a little bit of time, a few minutes for people to ask some more if there is anything else. And if you feel like chiming up, tell us something that you've learned that you might put into action. Darcy's also going to pop an evaluation form in the chat so that you can tell us how we did, how we can improve, and that helps us keep this